right. So I'm going to speak to you a little bit today about falls and how to prevent them. Falls is a huge concern. And I'm going to go through some of what, why, how. So what is a fall? And this is really the absolute definition of a fall is an involuntary event that actually results in a person coming to rest on a lower level from a higher level. And you don't have to lose consciousness. So this is with or without the loss of consciousness. So that is the definition of what a fall is. And sometimes if you're going to your doctor's office and they say, oh, have you ever fallen? People may trip, may just fall onto, they're standing and they fall onto a chair, or they may not think that that is a fall, but that is a fall because you lost your balance. You went from a higher level to a lower level. So why is it important? Some of the really important things is that actually, when you look at the rate of injuries from falls by age, you can see here that unfortunately, the darker kind of turquoisey color is women and the blue is men. And as you can see, as we get older, the rate of injury from falls increases, being very high in people over the ages of 85. Women are definitely much more predisposed to injuries compared to men. And this is why we care, because you get injured, and that's not good for you. All right, so being healthy, really important. We want to make sure that we want to be in our best condition as we get older. And aging can actually come with a lot of health challenges. And kind of head to toe changes occur, right? From eyesight to endurance to balance and bone strength. And that's just to name a few. However, there are things that you can do to maintain independence, and really trying to stay as healthy as possible. And the way we look at it actually is good health is equals to fall prevention. If you're in good health, your chances of falling are going to be much slimmer. And there are a lot of little things that you can do that you may not think of to help reduce falls and overall be healthier. So I'm going to just briefly talk about some of the facts that come with falls. And problem is that as we get older, our bodies actually have difficulty in withstanding a fall, and we tend to become more seriously injured, which can result in actually kind of life-changing events and results. So more than 1 out of 4 people fall every year. So that's 25%, which is a pretty significant number. And again, here we're talking about older adults, not the general population. Once you've fallen one time, you actually double your chances of falling again. And that is primarily because people lose confidence. They are, you tend to not go out very much because you're scared of falling. You do less activities. You're less social. And these are unfortunately some of the things that are good for you that help prevent falls. But if you've fallen once, you're less likely to do those, going out and being as, doing the good things that will help you prevent falls. And each year, almost 3 million older adults are treated in emergency room for fall injuries. That is a pretty significant event if you think about it, that this is happening every year. And falls are actually the most common cause of head injuries and any kind of traumatic brain injuries. So, how do you know whether or not you're at risk of falling? And there's several things that I want you to really keep an eye on, and take a note as I go through them as to how many you say, oh, yeah, that's a statement that I can kind of correlate with. So I have fallen in the past year. As I said, if you've fallen once, your chances of falling again double. So the next thing is, have you been advised to use a cane or walker, or that you already use one? And that is another risk factor. So remember, as I go through this, just put a little, tally up how many you might be at risk for. And if you've been advised to use a cane, you should most definitely use one, because they have actually, at some point, you have shown that there's a deficit in your balance and your strength. And unless you've done something to change that deficit, you will be at risk of falling if you do not use an assisted device like a cane or a walker. Sometimes I feel unsteady when I fall. Oh, sorry, I feel unsteady when I'm walking. I steady myself by holding onto furniture when walking at home. So again, keep a tally of what might be things that you might be a risk for. I am worried about falling, and I talked about that a little bit earlier. Of course, a lot of people as we get older are worried about falling. However, studies have actually shown that the anxiety that comes with falling can actually increase your probability of falling, because you're restricting the way you walk, you're restricting your activities, and that's going to reduce your muscle strength over time. And that actually the studies have shown that positive attitude goes a long way, and finding confidence in yourself and confidence in moving is really protective and important. I need to push with my hands to stand up from a chair. So this pretty much means that, for example, if you're sitting in a chair, you need to actually hold on to the chair, hold on to the sides to push yourselves up, and that you're not able to do that without doing that, you're not able to stand. This really talks and shows what strength your core muscles are and what is important in using those core muscles in order to stand. I have some trouble stepping onto a curb. So in New York City, there are curbs absolutely everywhere. And it's more of a culture of walking and being outside because we live in such an urban city. So if you have trouble stepping onto a curb, that's probably signifying that your muscles in your legs are probably not as strong. I often rush to the toilet. So as we get older, our bladder and our ability to hold our urine until we have to get to the bathroom can be altered. And this is something that really, if this is happening to you, that you should think about talking to your physician about, to make sure that there is nothing else that's underlying this. And if you're rushing to the bathroom, then this can actually cause people to fall because they lose their balance because you're rushing. I have lost some feelings in my feet. So there are multiple reasons why people can lose feeling in their feet, and some of them could be things like important medical issues like diabetes or a problem in your spine, and sometimes even a simple thing like a vitamin B12 deficiency can cause numbness and tingling in your feet. The other thing is, there is also other reasons why people can start to have some numbness and tingling in their feet, but definitely if this is happening, it should be a discussion with your doctor. I take medicine that sometimes make me feel lightheaded or more tired than usual. There are many medications, and there's an increase in number of medications that people take as we get older. And I'm going to talk a little bit more about how that plays into falls in a minute. And then I take medicine to help me sleep or improve my mood. So obviously medicine that helps you sleep can make you drowsy. And sometimes as we get older, the rate at which medication is broken down, it just takes longer. So that medication is hanging out in your body for a much longer time. And as a result, can make you sleepy even in the daytime and not only at night. And some antidepressant and mood stabilizing medication can also have the same effect. I often feel sad or depressed. Again, this is important because that can actually also, interestingly, research has shown that it can cause falls, and we can talk a little bit more about that in a little while. Because I do not see well, I have difficulty avoiding hazards in my path. So that is self-explanatory to some extent, because if you can't see well, or you have hazy vision because of cataracts, or you have macular degeneration where you may have pockets of your vision where it's not clear, any of those is going to make your moving around and seeing what you're able to see much more challenging, and as a result, cause you to fall. So I hope you are keeping a tally, because if you have two or more of the risk factors that I just went through, you are at a higher risk of falling. And if that is the case, then you should see your doctor so that they can kind of assess some of these issues that you may be having. So what's the basis of a fall? And we talked a little bit previously, but there are particular reasons that people can fall. Drugs and medications is a big one. A lot of medications out there can alter perception, can alter balance, and all of those reasons can actually make people more susceptible to falling. They can make you more sleepy, like I talked about previously. And sometimes medications can interact with each other. And when they interact with each other, they can cause some of the feelings that may make you a little bit more imbalanced. There's some common medications out there that actually can cause falls. A lot of times, it's a catch-22 situation where there's some medications out there that people take to help their bladder so that they're not running to the bathroom all the time. So you want to do that because you don't want to run to the bathroom all the time. But what ends up happening is some of those medicines, not all, some of them can cause imbalance and cause people to fall. We talked a little bit about gait and balance and how you walk and how steady you are. And if you're not very steady, then that can increase your risk of falling. Some neurological things, like if anyone's had a stroke before, or they have Parkinson's, or they have some issues with their spine, any of those things can cause people to be unbalanced and fall. Similarly, with heart disease, if you have heart disease, it can also contribute issues with blood pressure, with heart function, which can cause falls. If you can't hear very well, that's why we're always saying, please, if you can't hear very well, get it evaluated. It's better to use a hearing aid because, if you can't see very well and you can't hear very well, your perception of the world around you is very different. And your brain's not able to get all the information it needs to keep you steady and keep you from falling. Joints and mobility. As we get older, we have wear and tear of our joints, and arthritis is very common. And if something hurts, then you may walk in a slightly different way so that you can actually compensate for the pain. And that shift can also cause people to fall. And last but not least is the environment around us. And I'm going to talk a little bit more about that shortly. So what can you do? We're going to talk about various things. So home modification. And a lot of times what happens is that in your home, there are things that you may have had for a long time. You may have rugs, and I'm going to talk more about all of these things that may not now as you're older be the best for you. Clinical interventions is kind of seeing a doctor, seeing a specialist, and trying to minimize and maximize your health and minimize anything that might be causing your falls, such as medications and gait and so on. Single interventions, there might be single things that you can do, like join a fall prevention class or an exercise class to get stronger that may help you. And then we have the kind of multifaceted where it's really not just one thing you're doing, but you're doing multiple things to minimize your fall. And whether that is changing things around your house, talking to your doctor about your medication, going to an exercise class, using a cane or a walker. So you're doing multiple things together to all minimize your chances of falling. Interestingly, about 74% of all falls actually happen in the home. And actually, studies have shown that if you modify the home, it's been very beneficial in reducing falls. And I can, send you all a list, a home modification list of things that you can do in your house to prevent your home from being a hazard and more safe. Um, and it's an astonishing percentage about falling in the actual home, and this actually increases to 85% as people get older, so a pretty significant increase, and something to be thoughtful about. So where do you think most of the falls in your home actually happen? This is New York, so we don't necessarily live in multi-story homes, and some people may, but the majority of us live on one floor, so stairs can sometimes not be as much of an issue. However, if you live in a walk-up or you do live in an apartment which may be multi-level, there's unstable handrails, so making sure all of those are stable. Steps being uneven is an issue. And then carpet runners on stairwells are very, very dangerous. The other thing is the light. So if you have bad lighting over stairwells, that can also affect the ability to see and contrast what's step and what's not, and can be a big problem with falls. The most common place, however, is the bedroom. Partly it's because if people have a low bed, it's hard to get out of a bed if it's very low, especially if, joints aren't um, as mobile. It gets a little challenging if your muscle strength isn't very good. Loose items are very common. So if you have things on the floor, rugs that are not, if you have a rug, you need to make sure that you have a very good rubber backing to that. Poor lighting, sometimes, having table lamps are important, having lamps above is important, making sure there's plenty of light in the room, and loose items, things like bed covers, they fall off the bed and they're slippery. Slippers, again, if you have slippers in your home, making sure that they have very good grip, and not those kind of hotel slippers you get that are just like no grip and you can just go sliding. And then tripping over the slippers when we're getting in and out of bed is a big problem. With wooden floors, you got to be very careful. We recently had someone had recently waxed their wooden floors and just went and slipped right through, and had some injuries. So thinking about, your environment is very, very, very important. And I'm going to talk a little bit more about kind of bedroom's the number one place. The second place is actually bathroom, and we're going to talk about that shortly too. But in the kitchen, having very heavy items can be problematic as you're moving the items from one place to another. That can cause people to fall. Unstable chairs anywhere in the home is a problem because you can fall backwards, the chairs can break, and spills. Spilling some water, spilling some grease, anything like that on the floors will make the floors slippery. The living room as well, loose cords, telephone cords, different electrical cords, very important, having items just everywhere. So the key is to keep it as clean and clutter-free as possible, because if you have a lot of clutter, trying to get over clutter, trying to go around the clutter can be painful and very slippery and very dangerous. And the biggest issue time and time again is rugs. People do not like to get rid of their rugs that they've had for a while, or they may have sentimental value or be very valuable. Those roll over, so you can trip over them. They slip. You can, completely fall over them. So trying to keep rugs taped down and have a very, very good rubber backing if you absolutely need your rug. If not, it is better to not have them at all. So, this scenario we've talked a little bit about, rushing to the bathroom. And as we get older, unfortunately, that does happen a little bit more often. But is this what's going on? Where it's dark, and you're not able to see very well because you may have macular degeneration, or you may have glaucoma, or you may have cataracts. And at night, maybe you're not turning the light on. And so in the dark, you are running to the bathroom, and you may slip and fall. So we talked about this already. So this is kind of what it may look like, where, it's a dark bathroom, you can't see, and you may fall. Very important. The other thing in bathrooms are rugs. So we put down bath mats. Again, making sure those bath mats are not cloth throughout, but that they have a very, very good rubber backing is very important. Turn on the light. Simple, simple, simple thing to do is actually just turn the light on when you're going to the bathroom. A lot of people tend to have night lights in the bathroom you can get specific night lights that can be very, very bright so that you can actually see where you need to see, and you can adjust them so that they are lighting the path that you need to be lit. But ideally, turn on the light, because if you can't see, your brain, there's nothing telling your brain where to go, where not to go. The other thing, when in bathrooms, we talked about bath mats a little bit, right? So you do not want to have bath mats that are going to be slippery. They may look beautiful, but it's not something that you want. If you're going to have a bath mat, again, it should be something with a backing that is rubber and not slippery. Really good idea. Bathtubs and shower stalls can get very slippery. So having a rubber kind of non-slip mat inside the bathtub or the shower is really, really important, because you don't want to slip there. And then having a lot more kind of grab rails near the bathroom, near the toilet, in showers so that you can get in and out. Getting in and out of bathtubs gets to be more challenging, and we see a lot of falls there. So really trying to think about if you can do a shower stall, or you get all these new bathtubs that actually have doors that you can walk in and out of. But just thinking about that, this photo also shows you here of a towel mat type situation. That should never be on the floor because that may also cause people to fall. And in New York, we have supers and people in the building who can help with a lot of this. So trying to make use of that, have the super come in and say, I'd like a grab bar here, I'd like a grab bar there. And you can just kind of go through the home hazard checklist and see, okay, these are some of the changes that we need to make to prevent falling. The other very common place people fall is actually outside of the home. And New York is extremely, it's a great place for falls because there are a lot of uneven surfaces. There are people who are rushing. They're not always watching where they're going. There are potholes almost everywhere. And the sidewalks aren't straight. They're kind of curved. They go up and down, and there's a pipe coming out here, and there's something else coming out there. So really being extremely careful when you're outside, and trying to think about how you can minimize that on the outside is very important. The other important thing to think about is, how often do we do this? You are running, you are rushing. Oh my gosh, there's the M5 limited. I need to get on that bus. I need to get on that bus. I do not need to be waiting for a long time. I have to get to this doctor's appointment. I have to get to this class. Rushing will cause people to fall, primarily because you're rushing so fast that you're off balance, number one. And number two, as I mentioned, it's all uneven. So there's a higher chance of falling. And also because you're focused on where you have to go and you're not focused on how you need to stabilize yourself so you don't fall. So it's okay if you miss that bus. You'll take the next one. There shouldn't be a rush. So some of the clinical, so we talked about home modifications. I'm going to talk a little bit about clinical interventions. So as I mentioned before, make an appointment to see your healthcare provider. Really discuss your medications. Not only about, firstly, do you need so many if you're on many? Which ones should you be on? Which ones do you not need to be on? Which ones are safe for you as you get older? And which ones are not very safe? And the other big thing is which ones actually interact with each other. And if they're interacting with each other, are they going to, be a fall risk for you? So that's very important. Getting your eyes and ears checked regularly is really important because especially as we get older, we are much more susceptible to glaucoma, which is a high pressure in the eyes. So that can actually cause changes in vision, but more commonly, it's actually cataracts. So if you have cataracts, it's going to make your vision very fuzzy. And if your vision's fuzzy, you are not going to be able to see as clearly. Macular degeneration, another very common, unfortunate, kind of condition of our eyes, is when you start to have changes in your vision. So you may have pockets of your vision which are not clear and you can't see. And this is particularly important at nighttime when there isn't enough light, then that vision gets much worse. And we talked about hearing already, that it's very, very important to be able to get hearing well so that you have a better perception of the world around you and where the world that you're in. And then talking to your doctor, do you need a cane or a walker? Or do you need some physical therapy or something to get you stronger? And then really reviewing with your provider, your doctor, to say, what should I get in my home? Should I get a grab bar? Should I get a raised toilet seat? Because my toilet seat's really low and it's really a challenge for me to get on and off that toilet seat. Same with your bed. If your bed's really low, consider getting a higher mattress or a different bed, which is not so low. And having your kind of yearly physical exams, balance testing, all of these things can help prevent falling. And that's kind of important to address as well. So the one thing we talked about earlier, I alluded to, is single intervention. Exercise is really the best medicine to prevent falls. It, helps you stay on your feet. You need to move on your feet, and progressive balance and resistance exercises can really help improve your balance and increase your strength. This is a very busy chart, and I'm not going to run through all of them by any means, but I want you to kind of look very quickly at how exercise can increase absolutely everything from your brain to your heart to your lung to your muscles to your body composition, being weight and muscle mass and your metabolism. So lots and lots of benefits. In fact, this chart shows about 67 benefits at a cellular level that can help prevent falls. It's all very complicated, I know, but the important message is exercise isn't going to reverse your aging process, but what it does do is that it lessens the many harmful effects on your body. So really important. And imagine if I said to you, there is a pill you can take that is going to help you prevent falls. Everyone here would take it. So think of exercise as that pill. And there's actually a health initiative out there to make physical activity assessment and promotion standard care. It should be standard care across the board. It's called Exercise in Medicine. Exercise is Medicine. And it really encourages physicians and healthcare providers to include physical activity when designing treatment plans to help refer patients to more kind of evidence-based exercise programs and qualified exercise professionals to help develop a plan for you that makes sense for you, and that's very important. And thinking about physical therapy, has your doctor ever said, oh, you should do some physical therapy, it's going to help you? And what physical therapy does is it helps work those muscles, such as your core muscles and your glute muscles and your other muscles, to help strengthen your body, and so that your kind of core, so that you're not falling. You really don't have to go to the gym every day or do high intensity training, because a lot of people will say, but I have this condition and I can't go running, or I can't do this and I can't bike. It doesn't have to be high intensity. It doesn't have to be the gyms. You don't even need to walk 10,000 steps a day. Finding an exercise that you like is actually key. It may be walking, it may be dancing, it may be an exercise class, it might be Tai Chi, it might be chair yoga, it might be yoga, just regular yoga, it might be a Zumba class. Ideally, something that helps to increase your balance and strengthen your muscles is really what you're looking for. And in the community, there are a lot of different things that are offered that can really help you figure out, well, this is something I might enjoy. And unless you try it, having that positive attitude is really key. So not only is exercise good for your body, but it's actually really also very good for your memory and your mind. Um, you know, I Most people will jump on it and this is that magic pill that I'm talking about. Helps you with your physical well-being, but also your cognitive well-being. And two studies actually found that walking for 45 to 60 minutes, about 3 times a week, so not a big deal, for 3 to 6 months, they found that if you increase your heart rate over that time, it actually increases your memory. And our memory is helps, organize, prioritize your work, just kind of remembering short-term memory, long-term memory, very, very, very important. The other things that are very good or important is activity and stress. So when you are moving in different ways, you're transferring your weight, again, that is all strengthening you. Your core muscles, once they're strong, even if you trip, you're able to catch yourself so you don't fall over. Socialization is great. That's why we love group classes, because it's an opportunity for older adults to get out there and speak to other people and be with other people and engage in an activity together, so that it is not so isolating and it's more fun. Emotionally, it makes you feel better. And especially when you're successful, you're enjoying it and you want to go back. And that's very important as well. Researchers actually found that dancing with music as an activity lowered the amount of stress hormone. And it may not give you in your mind the aerobic activity you were looking for, but it has shown that it decreases stress, decreases cortisol, and it helps you feel like, oh, I'm going to want to do something a little bit more. I feel like I'm enjoying this. I want to do that. So thinking about what are some of the other things in your community that you may do to help you move more. So the other big thing is Tai Chi. In all the studies, Tai Chi actually has been shown time and time again to reduce the risk of falls and its related injuries from falls. Um, I'm not sure if everyone knows what Tai Chi is, but just a quick, telling you a little bit about it. Tai Chi is a special branch of Chinese martial arts that is both an internal and an external form of exercise. And it is mindful movement. So the movements are very slow, but very controlled. And Tai Chi is one of the very few exercises that have been shown to increase balance increase flexibility, and increase your heart health. So really, really great to do. Um, it's this kind of slow, continuous movement with very gentle resistance. So, this is what engages the muscle and engages it for a longer period of time. So it strengthens. And then that slow, continuous movement really engages your mind so that you're able and helps with focus. And again, in turn, helps with cognition. And the Chinese actually talk about energy flow, and one of the principles is with Tai Chi, you're going to help to have a more upright posture. Your spine is straighter, you're opening up your lungs as a result, and you're actually increasing the amount of oxygen that's going into your lungs, into your muscles, and giving you more energy. So really great principle that in Western studies have been shown to help decrease falls. There's also this kind of core principle is this relaxed body, calm and mind. And I talked a little bit about that earlier. It's because it's controlled movement, there's less stress on your joints. So people who have arthritis, for example, it's less stressful on those joints so that it's less painful. And this kind of song, jing, calm is really, really great for the brain. And Tai Chi can actually be done both sitting and standing. And so there's chair Tai Chi, there's standing Tai Chi. And because the movements are controlled and small, you can actually do it. It's very adaptable. And once learned, you can use it almost every day in your life. Doesn't take much time. And it helps with the kind of breathing as well. So the other benefits of Tai Chi: decreases pain, increases strength, lessens your stress, increases your balance, increases your posture, improves your memory. So very, all these wonderful things. And for arthritis, it decreases isolation. It increases one's outlook and one's confidence so that because you're able to use those joints, you're not just stuck indoors, not wanting to be able to go out for long walks because it hurts too much. So doing exercises that will get you out the house, allow you to do things which will not hurt, is really beneficial. The other really important thing is, your balance is affected by your health, and your health is affected by what you eat. So really important to try to keep things like your sugar under control, eating fresh fruits and vegetables. And very often we'll hear as we get older, don't feel like eating as much, I'm not eating as much, and that's okay. And you're not eating as much because things are taking slower to get digested through your body. And also, you're not moving around necessarily as much. And so you don't need as much metabolism and energy. But what you do eat is important, and it is important to eat well. And the Mediterranean diet, time and time again, will tell you that fresh fruits, vegetables, legumes, beans, all of those things are great for you. You want to limit saturated fats, and that will all keep you nice and healthy. Stress reduction plays a huge part in our health. So trying to find ways that work for you to reduce stress and relaxation. Your mind is super powerful and can help you do that. So this is a nice picture of getting out there, doing things, learning new things, socializing. The magic prescription I like to give is it's to be healthy. There are 3 elements to it: physical, mental, and social. So socialization, loneliness can lead to depression, and social isolation is actually a huge risk factor in falls. So keeping that in mind, trying to get out there, trying new things is very, very important. So the bottom line is exercise would strengthen balance in mind, healthy diet, get your eyes checked yearly, your ears, home hazard check, making sure what you wear is really important on your feet. You want to have shoes that are not slippery. You want to be able to have good track on your feet. It's not about looking beautiful. And nowadays, we're so lucky. There is so much out there so that you can look beautiful and have really good grip. Get out and about, socialize, be with other people, try to relax and de-stress. Thank you so much for your time today. And I left time for questions. I'm going to take a quick look in the chat. Let me just open this up a little bit. Okay, so after my fall, my rheumatologist was proactively sending me for physical therapy to work on my gait and balance. Absolutely, really important. Physical therapy is key because it really does help you get stronger. It helps you, they're targeted. So it's working with certain muscles that are really important in your core, in your strength, and that is what's going to help you. They're going to work with you. It's what you need and giving you exercises to help with that. The one thing I will say though, it's not enough, unfortunately, to just go to physical therapy twice a week for the 30 or 45 minutes that you're getting there. You need to do the exercises at home. And when your physical therapy has ended, you need to continue doing those exercises every day because the muscles need constant work slowly, slowly, slowly every day. It's no magic that it's going to happen overnight. So that's really great. Um, Someone wants a copy of this presentation. That is completely not a problem. So I'm happy to send that over to you. Did anyone have any other questions? I'm more than, if it's not in the chat, you feel free to unmute and I'm happy to answer any.
Well, I can get us started, Dr. Rughwani. First of all, thank you. That was brilliant. A lot of information in there. So I do have a few questions. Why are women more prone to falling than men?
That's a really good question. Partly, I think it is more of a balance issue. There's some evidence in the literature as to whether maybe men were coming into this age group fitter than women, potentially. And the third, actually, the more important one, I think, is that women tend to live longer than men.
Yeah.
Just, that's just the statistic. So whether that has something to play in it is possible too.
Okay, very good. So a question about walking. I do a lot of walking, but does, I mean, on the one hand, walking would seem to be good for balance, but on the other hand, is if you walk more, are you more prone to falling?
Right. However, if you walk and you walk outside, you're also strengthening those muscles. So if you're walking carefully and have a strong core, the more you walk, the stronger you become. So it's really important to keep walking. It may make you fall if you're not strong, but the more you walk, the stronger you will become. It's a
Okay.
form of exercise and a form of getting stronger.
Right, right. And similar question about stairs. I mean, stairs do just by nature seem very risky, but I think it's also like really good for your heart, right? If you're walking upstairs.
Absolutely. And it's really actually good for your body too, because you're using these other muscles. Hold on to railings, especially if you're a little unsteady. If you hold on to railings and do it slowly, you will slowly build up your stamina, which will be really helpful and useful as well.
Okay. And one more question. So you talked about using lights at night, but if you have a spouse, and sometimes the spouse gets upset because you turn on the light,
Mhm.
how would you deal with that?
So the other big thing I would say is actually using a night light can sometimes, if you have a night light in the home, it can actually be very like, in your bedroom. So it lights the path and the newer night lights are really great too. So, they can actually light just the base so that you can actually see where you're going. Um, and you can have those in the bathrooms too. So that's usually very helpful.
Yeah, actually, I saw one recently in a hotel room. Yeah, you can see where you're going, but it doesn't light up the whole room too. to annoy
Mhm.
people.
Yeah,
Yeah,
and those
that's
are really, really great.
okay. Excellent. Well, there's a lot of information there. I do see we got another request for the slides. If you want to send them to me, I can post them on our website, or we can try sending them out. It's up to you.
So let me just hang on a minute. I'm just gonna open up. Can you just give me your email address and then I'll send, or should I just send it to Dolores?
Yeah, so there's Dolores and then also Susan just put her
Oh yeah, Susan.
email address
Okay,
in there. But
so
if you do send them to me, I can post them on our website.
okay, if you could just give me your email. Hang on, let me just get this
Sure.
email set up so that I can. Oops.
While
There we
that's happening, hi,
Yes.
doctor. We were
Hi.
emailing. My name's
Yes,
Jenny.
thanks, Jenny. Thank you so
Thank
much.
you so much for being here. Your presentation was great. We have our next one with Dr. Emily Samuels next
Oh yeah,
month.
perfect.
Yeah. So yes, please share the slides with us and then we'll put them on our learning management system. For everyone who's here, thank you so much. I'm going to put in the chat our next event next month so you can enroll and register there. We're so thankful for the Mount Sinai doctors to come on and present to our members. So we'll share our
Our
resources
pleasure.
and thank you very much for being here.
Absolutely. Thank you so much for having me and feel free. I will send the slides over in a little bit. And thank
Great.
you again. Thank
Dr.
you.
Rughwani, I see there's one more comment in there about someone's talking about smartphones.
Oh, right. I think it's very important to focus for not. Yes. Oh my goodness. Yes, yes, and yes. Um, Smartphones are a big problem. And even though you may not be on it, there are other people around you who are. And what ends up happening is that they're on their phone and they're looking down and they're not watching where they're going and they can just bump into you, especially if they're coming from behind you. So you can't see that they're there and they push you over and you fall. So really, when I try to do, even, I try to do this myself, is I try to actually stay to the side, like if I'm on a sidewalk, I'll be more to the side of the building so that people who are walking fast on the other side have plenty of space to walk. And if they're not watching, they can go ahead and not watch. But smartphones are a big issue. So please do not use your smartphone when you're walking for two reasons. You're not going to see what's in front of you and you're not going to see what's on the ground. So if there's a big pothole or a big pipe standing out or a tree trunk that is, this is New York, it is a little bit crazy and you could fall and trip and it happens all the time. So really, really try to not just be cautious about yourself, but about the people around you, because that tends to be more of a problem than you.
Yeah, that's great advice. And I find personally that it's much more scary crossing streets in Manhattan with all these electric bikes and
Mm,
people going in both directions that you really have to pay attention.
absolutely. I can't stress that enough. Really look, how we're taught, look left, look right, look left again, or right, left, right. Like do that 4 times because there'll be a bike that comes out of nowhere. And it's so unfortunate because a lot of the falls we do see are with the bikes because they're not following the rules of the road. So, you know, if it's a red light and it's time for you to cross, you would imagine that the bikes would follow the rules, but they don't. And that's part of the problem. So definitely bikes and phones, be very careful.
All right, excellent advice. Well, thank you again, Dr. Rughwani. This has been really great.